So we have been at the National Patient Safety Foundation really trying to advance the field of safety across the entire care continuum. So we did a report called Free from Harm, and one of the 8 recommendations about how to accelerate patient safety was that we need to think about safety across the entire care continuum. So it's not just a hospital issue. We know there's safety issues in the primary care setting, in nursing homes, rehabs, dialysis centers, and in the home setting. We have been doing work, for example, on diagnostic error and thinking about ways to reduce diagnostic error, which is one of the key safety issues in the primary care setting. And we are just finishing up a project funded by the Moore Foundation to do an assessment of what are safety issues in the home. Because so many more patients are more complex patients are now being taken care of in the home, and we know there's many safety issues associated with that. So the results of that project are coming out in a couple weeks, where we're going to really highlight what are all the safety concerns in the home setting, and then we have some follow-on work that we're doing to think about, okay, based on that, now what should we do in terms of recommendations for next steps to try to mitigate some of those risks. Yes, as of May 1st, NPSF and IHI merged, and this was really a mission-driven merger. We believe we can save more lives together than apart. We have both worked on patient safety over the last 15 or 20 years, but we've worked on it in different ways and in ways that we think could be really synergistic. So we've been doing a lot with thought leadership and best practice creation and those kinds of things, membership, certification. They've been doing a lot of what I call boots on the ground improvement work, working with hospitals and health systems to actually implement things. And so we think that the marriage of those two strengths can really help advance all of our activities going forward. So, a great example is work we've recently done on creating a blueprint for the C-suite for creating a culture of safety, which is really a thought leadership piece with strategies and tactics about how to really drive forward a culture of safety. And our colleagues at IHI that we're now together with can really help us think about implementation of that blueprint, which in the past we would have released it but not had that implementation side. So we're really excited about the ways that we can work together and really be a stronger, more unified voice. There's so many voices out there, and we just want to be a stronger, unified voice really driving forward the safety agenda.